Assalamu alaikum. A 6-month 3D CBCT assessment of periapical healing after a conventional endodontic treatment with 3 different endodontic sealers. This prospective clinical trial was published in the European Endodontic Journal by Osorio in 2026. This study aimed to compare the healing of periapical lesions after single-visit root canal treatment using 3 different endodontic sealers, which were zinc oxide eugenol sealer and epoxy resin-based sealer, and as well as a calcium silicate-based bioceramic sealer. They wanted to determine whether the type of sealer could influence the healing process of chronic apical periodontitis. They used a 3D CBCT imaging and volumetric analysis to provide a more accurate evaluation of lesions that could heal over a 6-month period. So they had 75 patients in total. They were divided into 3 equal groups according to the sealer type, and only single-rooted teeth with clear visible periapical lesions on CBCT were included. All of the root canal treatments were completed in a single visit under a standardized clinical condition by a postgraduate endodontic student, and the root canal preparation were performed using Wave 1 Gold reciprocating system, and the irrigation used was full concentration of sodium hypochlorite with 17% EDTA with ultrasonic activation. So after cleaning and shaping, the canals were obturated using gutta percha with the assigned sealer according to each group. And CBCT scans were taken, like I said, before the treatment and again after the 6-month follow-up period. So they found out that all the 3 sealer groups produced significant healing of the periapical lesions after 6 months, and the lesion volumes decreased considerably in all of the groups. In regards of H plus sealer group, the volume reduced from 81 cubic millimeter to 15 cubic millimeter, and by a C sealer group reduced from 63 cubic millimeter to 12 cubic millimeter. And in the last group, the volume reduced from 36 cubic millimeter to 4.5 cubic millimeter. So the percentage reduction in the lesion size ranged approximately between 79 and 85% across all the groups. So as they mentioned, despite the known bioactive properties of bioceramic sealers, the BioC sealer did not show statistically superior healing compared with the 2 other groups, and there was no statistically significant difference among the 3 sealer groups in regards of total volumetric healing or the percentage reduction of the lesion. So they suggested that the success of healing depended more on adequate disinfection, proper obturation, and the body's natural healing response, rather than on the chemical composition of the sealer itself. So they concluded that all of the 3 sealers were effective in promoting periapical health or healing after root canal treatment, and as we mentioned, the type of sealer had minimal influence on tissue repair.